Okay, so Doris Bowman is a 39-year-old female, full code. She just underwent a total abdominal hysterectomy with bilateral salpingo-oophorectomy with general anesthesia. She has no known allergies. This patient was admitted to the PACU today. She tolerated the procedure without any complications, and now she has an abdominal incision covered with a 4x4 gauze dressing with no drainage noted. Patient has an IV in her right arm with potassium chloride in 5% dextrose, and normal saline is infusing at 125 milliliters per hour. She has estimated blood loss of 400 milliliters. Her most recent vital signs were blood pressure of 142/90, respiratory rate of 14, pulse of 110, and regular. SpO2 of 94% on nasal cannula to be maintained over 92%. Temperature is 99, and she is alert and oriented ×4. Her skin turgor is normal, and she is very sweaty and has cool skin. Patient reports a pain level of 6 out of 10. I administered 2 milligrams of morphine through an IV push every 4 hours PRN. After administration, the patient underwent respiratory distress and her respiratory rate decreased to 4. I quickly had assistance to help with ventilations for 1 minute, and I gave naloxone as a reversal. I gave her, of this naloxone, I gave 0.2 milligrams every 2 to 3 minutes PRN. Or less than 6, or a change in consciousness through an IV, and her respiratory rate then increased to 19. I also administered 4 milligrams of ondansetron IV push every 4 hours PRN. She reports no nausea or vomiting. She has normal lung sounds, normal heart sounds, and she has hypoactive bowel sounds. I placed an ECG monitor to continue to assess these heart rhythms. Surgical dressing was clean, dry, and intact. She also has a Foley catheter inserted, and there is 220 milliliters of clear urine in the bag. She has no signs or symptoms of postoperative hemorrhage. I sat her up in bed to give her sips of water to advance her to a clear liquid diet as tolerated. Hopefully this evening we can get her on that diet. Activity orders are just to get her out of bed tonight. Abnormal lab values that I saw were hemoglobin of 11, hematocrit 34, white blood cell 10.1, platelets 242, and creatinine 11. I recommend keeping an eye on her respiratory rate and notifying the provider to find an alternative solution to control her pain and or switch her medication dosing. Continue to monitor her vital signs and watch her inputs and outputs. Advance her to clear liquids and get her out of bed later this evening. I also suggest transitioning her to room air for oxygen and keeping an eye on her peripad counts and any other signs and symptoms of post-op hemorrhage.